another top story that we are following now. Based on discussions by the scientific community linked to a third wave, a committee of experts constituted under the National Institute of Disaster Management, which falls under the MHA, has recommended better medical preparedness for children who may be at similar risk as adults in the impending third wave. In fact, while highlighting that pediatric facilities in the country were nowhere close to what may be required, the expert panel called for improving hospital facilities for children and vaccination of children, including those with comorbidities. A member of the panel, though, added that they have not given any timeline as to when the third wave is likely to hit. I'm joined on the broadcast by Dr. Sunila Garg, Lancet Commission and COVID Task Force member. Dr. Garg, thank you so much for joining us. I believe you were part of this panel, which has given these recommendations, which are now online on a website. If you could just tell us, what are some of the key pointers? I believe that the report focuses primarily on how there needs to be a boost to COVID care facility meant for children.
Yeah, number one thing is that we have to be very much prepared for any number of waves. Number one thing, that is very clear. Number two is that we have to prepare at all levels. That means we have to prepare our healthcare facilities in terms of availability of beds, not only for adults but for children. And that means we will also require beds which are tailor-made to children, including the ventilator facilities also. If at all there is a third wave which is focusing on children, as of now, I do not see any reason that children are going to be, affected in a major way, because wave 1 and wave 2 did not show that, and infection in children is milder in nature. But one thing which is of importance right now is that we need to be, kind of looking at from the perspective of the number of cases in different states also, like Kerala and some of the states in the northeastern part where the number of cases are still very high. So that is important part of it. But nonetheless, we have to accelerate our vaccination drive, which is still, we have covered 58.1 crore individuals and about 13% of the people are fully protected. So we have to see that the fundamental principle is that once we are, covering the adults, the children will be protected. The vaccination for children, though, is available, but it is important to understand that for the children also, we have to go in a phased manner from 18 years or 17 years to 12 years. And once they require the vaccine, if at all, they are suffering from any comorbidities and all that, so that should be prioritized. But priority should be on vaccinating all the adults, elderly, and frontline workers. And then also we are now thinking of in terms of boosters. That is important. That means for frontline workers and all that, we will have to think about that. But then right now, we have to first focus on complete immunization also, the systems preparedness, the training of these people, and also looking at some of the important issues like, MIS syndromes in children and all that. For all of that, but again, our testing, tracking and surveillance has got to be in place so that we can do, contact tracing adequately. And also we have to focus upon our home isolation part in a big way, because we saw in Kerala that home isolation, though is there in 85% plus individuals, but then it is not followed appropriately. So these are some of my important comments.
Right. And ma'am, as we said, that these are, of course, you were part of that expert panel whose recommendations are now public. As you were saying, ma'am, before I let you go, Dr. Garg, that there is no... It's not just about children the kind of preparations that need to be made, but the fact that we've seen a number of developments recently. Zycov-D has been given the emergency use nod by the government. Now, this expert panel's recommendations, of which you're a part, is also talking about the preparations which need to be made in terms of COVID care for children. What do parents need to keep in mind? As you're saying, there needs to be some caution maintained when it comes to vaccination of children with comorbidities. What do parents need to keep in mind based on the panel that you were a part of, their recommendations?
One thing which is very, very important is that parents need to not be very apprehensive. They have to take care of the children in a very appropriate manner. That means, children have to be taught about COVID-appropriate behavior, and especially when I'm talking of children above 5 years of age. Okay? So that means they can practice masking and also frequent hand washing and maintaining of distancing, physical distancing, if at all they can do. Because on one hand, we are also talking of opening of schools also. There also, it will be very important that the children right from the beginning are sensitized. But one thing I will like to say that infection in children is milder and it will go away faster. So, but then COVID appropriate behavior has got no substitute. Then, because we have to follow the physical distancing and masking also when it comes to children above 5 years of age. But the parents have to make sure that they themselves are vaccinated and the elderly in the families are vaccinated. That is
Right.
important part from the perspective of children.
Dr. Sunila Garg there, thank you so much for joining us on this broadcast.